I'm Alan Pritchard. I'm the IT Director at Austin Health, which is a tertiary and quaternary public health service in the north of Melbourne.
Amazing. Alan, I just realized that after 520 something episodes of Talking Health Tech, I've got a diminishing list, but it's still an existing list of people that should have been on the podcast a long time ago, but it just, for whatever reason, it hasn't happened yet. So I'm super grateful that you've been able to have a chance to come over and have a chat here at Digital Health Festival. I've seen a lot around what Austin Health is doing in digital and technology over the years. I can hazard a guess at what brings you to Digital Health Festival, but what brings you to the event today?
So I come here to try and get in touch with what the industry is doing and where it's heading in general. I come here for the networking. It's a great event to catch up with all sorts of people. I come to try and learn about what we should be thinking about next within the health sector, although I also use other industries a lot for my guiding star, I suppose, when it comes to technology.
Yeah. That's super interesting. Well, tell me more about the using other industries.
Well, I don't think we do a great job with technology in health in general. There's good reasons why that, if you look back over the last 30 years, but we've got pretty broken systems. Most of our apps aren't great if you compare them to consumer grade or even the sorts of things that other industries, banking and finance, use. We're very slow adopters of almost every innovation at any scale, at least, and in any sort of enterprise and manner. But on the other hand, we have pockets of people doing cool stuff with little apps all over the place, which I think is great from a exploratory perspective, but it's not good from a patient experience and security and as I said, how we manage our estate of enterprise applications.
From my external observation, I understand Victoria, and specifically, I guess Austin Health and the region you're in, approach technology and EMRs differently to other states and how they might approach it. Talk to me about that approach towards the technology that you use within the health system.
Yeah, so Victoria, for historical reasons, has not had a centralised EMR delivery capability, such as they have in New South Wales and Queensland. I don't think that's necessarily a bad thing. Every health service gets to choose the tools and technologies that are right for its own clinical environment and its own workflows. Possibly there's a little bit of too much local customization goes on, but in general, I think everybody has tools that are fit for their own local environment. The disadvantage is there's less sharing of patient information across health service A to health service B, which obviously is enabled in New South Wales and Queensland. The advantage is I think we can innovate better and faster in Victoria than other places. The advantage is we can innovate locally in our own health services. And I think some of the disadvantages of all having different systems are starting to go away with the Health Information Exchange, CareSync Exchange, so that now the Department of Health is rolling that out and we will be able to see patient information across health services. And also some of the work we're doing with the CRM, which are kind of that patient engagement level across or digital experience level across the state. I think between those two things, they'll start to pick up the slack of not having everybody on the same EMR.
Interesting. And talk to me about some of like what that looks like, some examples of some recent innovations, because we're talking a little bit, like we heard a lot about the potential of generative AI and emerging technologies here at this event and just generally within healthcare. What are some examples of some more recent adoptions of emerging technologies, I guess, within Austin Health?
So within Austin Health, I think let's go back 6 years, we were one of the first health services to go all in with Microsoft 365 and adopt that as a licensing model and an approach. That doesn't, and this is what I mean about, we're so far behind in health. That doesn't sound very innovative, but it actually quite was at the time. And it's enabled the organization to move forward with sort of reporting and dashboards and better collaboration tools, an adoption of low-code capability across the Power Platform suite. So again, small innovations, but all built off the decision to move to a more modern platform, I suppose.
Yeah. And you were up on a stage at some point here at DHF?
Yeah, I've done two things. I was on a panel talking about real-world application of AI at Austin Health, or in health, and I've just done a little presentation at the Microsoft stand about what we've done with Gen AI. So specifically on Gen AI, about a year ago, I sat with my team and said, I think we need to get our hands dirty with this and do something, because everybody a year ago at this conference was talking about you need to govern it, but I don't know how to govern something if I don't know what it does or how it works or anything. So we picked a few projects that we could do internally, and we found a coalition of willing and engaged clinicians, some of whom brought their own projects, and we've really just done this sort of smorgasbord of projects, just looking at how we can leverage the AI, LLM, vision related models that are available through Microsoft Azure, using our data and see if we can deliver any insights or what we can learn from it. And I think what we've learned is it's not that hard. There's some great tools available. We're all using the same half dozen foundational AI models across the whole world, effectively. Every organization is pointing back to some variant of GPT or Llama or Birch or something like that. Clearly, Gen AI does some things really, really well and some things really, really badly. And I think that's why you need to get in and do some experimentation, and because you've got to learn why some things work well and why some things work badly. And then you've got to understand how you can change that approach to try and deliver some clinical value. So we've got a lot of exciting projects going on, and I'm hoping that maybe this year some of them will actually translate into use.
Yeah, I love that. I mean, I feel like that makes a lot of sense to me. How do you go about allowing that flexibility to try things and fail and iterate and all that? As we always talk about in healthcare, it's like we don't have room to fail, and there's patients' lives and all this kind of stuff. And it's difficult to invest, be it time, people, resources, whatever, in I guess R&D or working stuff out. What's your approach there?
First of all of these are research projects. There's nothing operational here, and so that there's no risk associated with this. How you carve out the time is a really interesting one. So first of all, if you've got engaged people in your IT team and you say, hey, who wants to come and do some work on Gen AI, there's quite a lot of them are going to leap at the opportunity and really want to do it. Some don't. They see it as a threat, or they're just too busy with day to day. But there's some really engaged people who've jumped at the opportunity. And then the other thing is we have started using the industry supplied AI tools for development activities. So the same developers that are doing this kind of slightly frontier work with our data and Azure AI services are using GitHub Copilot to do their coding, their documentation. So they're clawing back a few hours a week on the one side and getting rid of some really humdrum work. They're making code reviews more efficient, and as a result, improving the quality of their code. And they're pulling back some time to devote to the more fun stuff.
Lastly, Alan, anything that you'd hope that, I mean, there's always an interesting mix of people here at Digital Health Festival. There are clinicians, a lot of the vendor community, and a lot of, I guess, people keen to make an impact. What do you think people are starting to walk away from this event? And how much do you think will be applied into the real world of healthcare?
I think there'll be a huge growth in AI scribes, because that's technically a simple, well, actually I shouldn't say that. The scribing side of it is technically straightforward. The integration in the workflow is slightly less simple, but I think that there'll be a big adoption of AI scribing technology. beyond that, I expect not a great deal will change. I mean, we evolve very slowly in this industry. I was just saying to somebody from Microsoft, I'm super proud of the little projects we've done. And when we got some actual results about how accurate Gen AI is to do a task, I was so excited. And then I read an article about the shipping industry that's using AI to make sure that container ships arrive at the port at exactly the time to be unloaded and saving 250 million a year in fuel costs. And it's like, yeah, okay.